Hospitalizations for the highly contagious flu virus have soared to near-record levels, sparking urgent calls from the CDC for widespread vaccination efforts. But here's where it gets controversial. Despite these alarming numbers, many still underestimate the flu's severity and the importance of getting vaccinated. Last flu season, hospitals across the country faced an unprecedented surge in severe flu cases, reaching the highest hospitalization rates seen in over a decade. According to the CDC's latest reports, nearly 39,000 people were admitted to hospitals with the flu between October and April during the 2024 to 2025 season. This figure is staggering, especially when you consider that the hospitalization rate was 127.1 per 100,000 people, more than double the average rate recorded over the previous 14 flu seasons. In fact, this was the most severe flu season since at least 2010. The peak of this intense season came in early February, when weekly hospital admissions for the flu hit their highest point in over 10 years. A striking detail is that over 70% of those hospitalized were unvaccinated, highlighting a critical gap in protection. This raises an important question. Why do so many people still skip the flu shot despite clear evidence of its benefits? Clinical outcomes for hospitalized patients mirrored those seen in other severe flu seasons. Approximately 17% of these patients required intensive care unit (ICU) support. 6% needed mechanical ventilation to assist breathing, and sadly, 3% died during their hospital stay. While the CDC did not provide an exact death toll, the most common complications included pneumonia, sepsis, a dangerous bloodstream infection, and kidney failure, conditions that can rapidly worsen a patient's prognosis. Interestingly, about 85% of hospitalized patients received antiviral treatments such as Tamiflu, which can help reduce the severity and duration of the illness. However, treatment rates were notably lower among children and teenagers. This likely stems from a common misconception among parents that the flu is a mild illness in children and that their strong immune systems can handle it without medical intervention. But this assumption can be deadly. The American Academy of Pediatrics reported that 216 children died from the flu last season, marking it as the deadliest non-pandemic flu season on record for U.S. children. This is a sobering statistic that many overlook. Each year, scientists from the World Health Organization and the CDC collaborate to decide which flu strains should be included in the upcoming season's vaccine. This process is complex and involves predicting which virus strains will be most prevalent. Because the vaccine formula doesn't always perfectly match the circulating viruses, its effectiveness can vary. On average, flu vaccines reduce the risk of needing a doctor's visit by 30 to 60% and significantly lessen the severity of symptoms when infection occurs. Timing is crucial. Protection from the vaccine diminishes over the course of the flu season, so getting vaccinated in October is ideal. The CDC recommends annual flu shots for everyone aged 6 months and older, including healthy young people without underlying health issues. But here's the catch. Vaccine effectiveness depends entirely on how accurately health officials predict the dominant strains. Last season, the CDC estimated that the vaccine was between 41 and 78% effective at preventing hospitalizations due to the flu, and 32 to 60% effective at preventing less severe infections that still required medical attention. While most people recover from the flu within a week, the virus remains deadly, claiming about 36,000 American lives annually. It poses the greatest risk to seniors aged 75 and older, individuals with respiratory conditions like asthma, those with obesity or heart disease, and the unvaccinated. Beyond common symptoms such as fever, muscle aches, chills, fatigue, and respiratory issues, the flu can lead to life-threatening complications, including pneumonia, sepsis, inflammation of the heart and brain, and muscle damage. The CDC's Flu-ServeNet surveillance system, which gathers data from around 300 hospitals in 14 states, provides a detailed snapshot of flu hospitalizations. This network covers roughly 9% of the U.S. population, about 31 million people, and focuses on lab-confirmed flu cases severe enough to require hospitalization, spanning all age groups from infants to seniors. For a carefully selected group of patients, researchers examined medical records to identify underlying health conditions, vaccination status, and whether intensive care was needed. Among children, asthma emerged as the most significant risk factor for hospitalization, affecting 14% of toddlers and preschoolers and nearly 40% of school-aged children and teens. For young adults aged 18 to 49, obesity was the leading risk factor, present in about 44% of hospitalized patients. Adults aged 50 to 64 were most affected by chronic metabolic diseases, primarily diabetes, which was found in 45.6% of patients. In seniors, cardiovascular disease was the dominant risk factor, seen in 57% of those aged 65 to 74, and a staggering 69% of those 75 and older. This flu season was historically severe across all age groups, with hospitalization rates 2 to 3 times higher than the average of the past 14 seasons. Seniors aged 75 and above were hardest hit, with nearly 599 hospitalizations per 100,000 people, the second highest rate ever recorded for this age group. For every other age group, it was the worst season on record. Pneumonia was the most common complication, developing in 30% of patients. Sepsis occurred in 18.5% of cases, and acute kidney failure affected 18%. The dominant viruses driving this severe season were influenza A strains. Notably, the H1N1 strain caused higher hospitalization rates among older adults compared to the H3N2 strain, reversing the pattern seen in the 2017 to 2018 season when H3N2 was more dangerous for seniors. Looking ahead, the 2025 to 2026 flu vaccine is trivalent, designed to protect against 3 strains: influenza A, H1N1-like virus, influenza A, H3N2-like virus, and an influenza B, Victoria lineage-like virus. For most people with insurance, the flu shot is free, as insurers are generally required to cover CDC-recommended vaccines. Without insurance, costs can vary widely, from $20 to $120 depending on the pharmacy, but public health clinics often provide free flu shots. So, what do you think? With hospitalization rates skyrocketing and vaccine effectiveness varying, is the push for mass vaccination enough? Are we doing enough to protect vulnerable populations, especially children and seniors? Or is there more we should be questioning about how flu seasons are managed and communicated? Share your thoughts and join the conversation below.